We can observe that the province of Misiones has a young population because of the largest bottom and greater pre-reproductive and reproductive age population, in which the female sex is predominant in terms of the number of members and their longevity. Meanwhile, the birth of males predominates. The economy in Misiones. In the province of Misiones, 59.01% of the population is economically active, the highest exponent being the group of men with a percentage of activity of 61.09%. Within the non-economically active population group, women represent the largest number in percentage with 68.25% compared to 31.75% of men. Being the male gender more economically active suggests the physical exigency and deterioration leading to a higher death probability and lower life expectancy.
Environmental dimension. In the province of Misiones, the surveillance of vector-borne diseases is an important point for maintaining balance in the health of the region. Among them, the most important are dengue, leishmaniasis, yellow fever, and Chagas, some preventable by vaccination and others by vector control. Intense rains bring deep-rooted periods of very humid and low atmospheric pressure, being able to impact indirectly on health due to the proliferation of insects and rodents vectors or transmitters of diseases such as dengue, yellow fever, leishmaniasis, malaria, gastroenteritis, and also produces the conditions for vulnerability to acute respiratory infections. Another circumstance that negatively influences the health status of the population is that in times of abundant rainfall, the accessibility of healthcare providers to rural settlements, jungle settlements, or settlements separated by overflowing rivers and streams, or of their inhabitants, the health effector may not be able to pass through.
The lifestyles of the population have been changing. Based on new forms of work, recreation, and communication, in these years they have favored non-communicable diseases caused mainly by physical inactivity, unhealthy eating, smoking, and the consumption of alcohol. In the province of Misiones, particularly, physical inactivity presents high values. It is higher in women. This trend increases in older ages. It can be observed from the analysis of the data that men have greater consumption of substances such as tobacco, alcohol, and greater consumptions of salt. These being great risk factors for different pathologies. One positive factor is that they have lower rates of physical inactivity than women.
Distribution of the Provincial Health Organization. The health zones are the geographical framework where primary care is provided, and it is made up for the municipalities determined by the map, which includes the 75 municipalities. Misiones has 6 health zones and 19 program areas, in which 42 hospitals and 340 primary health care centers operate. And now we are going to show you the trend graph of infant mortality rates in the province of Misiones in the period of 2003 to 2012. There is a sustained downward trend in neo and post-neonatal infant mortality rates in the province.
It is presumed that among the main causes of death of these children are domestic accidents, or those that occur at home, such as falls, poisonings, allergies, and irritations, burns, fires and explosions, electrocution, respiratory asphyxia, trips and blows. Bounds, burns, and sprains are the accidents that occur the most with children.
These tables are tables of live births according to weight of the child at birth and age of the mother. In the province of Misiones, pregnancy is one of the problems faced by teenagers and raises the need for it to be treated from a comprehensive angle. Analyzing how socioeconomic factors and education within the family appears as causes to deepen it. A reason for this is the lack of development in the province. Comparing the population pyramid of Misiones with the Buenos Aires pyramid, we can easily recognize the differences. Buenos Aires, as a center of development in Argentina, has more tools and health systems, which are related to the difference in a rate of birth, death, and the shape of type of the pyramid.
The pyramid of Buenos Aires population of the year 2010 shows a base that begins to narrow due to the reduction of the birth rate, and a peak that is widened by the increase in hope life, especially among women. This type of pyramid corresponds to societies that have begun the so-called demographic transition, tending to a progressive aging but still maintaining a progressive dynamic with a majority of younger age groups.
In comparison, the birth rate of the Misiones pyramid is higher, probably due to the adolescent pregnancy and the lack of means of contraception and disinformation about sexual education, something that the province of Buenos Aires is capable of providing for free. In addition to the fact of the difference in circulation and transport networks. On the one hand, in Misiones, the lack of development of these leads to a main problem suffered by the provinces of the interior, the distance between centers, establishments, and essential centers like hospitals. While in Greater Buenos Aires, as we said before, is one of the most developed provinces in most sectors. It has a network of train transport, public transport as a collective, and highways spread throughout its territory. This distance between facilities is an obstacle they have to live with from day to day. Many, due to lack of resources, have to walk these distances, causing a deterioration and a great expense in physical and mental health of the population.
Comparing the pyramids, we can see that the older and more adult population in Misiones have higher death rate than Buenos Aires, and it is related to quality of life. All the factors that we have already mentioned, both environmental and health, diseases, and the development of transport, industrial, and health systems. Finally, comparing the mortality rates, both in general and infant, and the birth rate, we come to the conclusion that Misiones figures are higher than those of Greater Buenos Aires in all aspects. This is based on the health analysis shown in Misiones and with the general development difference between Misiones, this one having a greater disadvantage, and Greater Buenos Aires, prevailing and standing out with its higher development in all areas.